If you're leading a senior living community today, you know exactly how complex it has become to deliver consistent, high-quality care. Even with a strong staff and a great culture, there are moments when everything comes down to timing. You see it when a resident's health changes overnight and there isn't a physician immediately available. You feel it when you need to decide, do we wait and watch or do we send them out to the ER? And you live with the challenge of balancing the expectations of families, the capacity of your team, and the limitations of the traditional care model. These are pressures every executive director, every nursing director, and every administrator knows all too well. The structure most senior living communities work within hasn't changed much in decades. Residents rely on your nurses and caregivers every day, while physicians come in occasionally on a rotating schedule. And when something urgent happens, you have to send people out. That approach often means avoidable hospitalizations, disrupted schedules, staff burnout, and family frustration. Over 40% of emergency room visits from senior living communities could be avoided if issues were caught and addressed earlier. That statistic is not about effort, it's about structure. You have built an excellent team, but the current model leaves gaps that no amount of effort can fill alone. This is why we created Sigma Humans. We are a physician-led healthcare service built to close those gaps. We integrate directly with senior living communities to provide scheduled medical visits, 24/7 telehealth support, and advanced procedures by appointment, all coordinated by a dedicated liaison who makes sure nothing falls through the cracks. Our mission is to strengthen your model of care so that your residents get timely, proactive medical attention without adding to your workload or your costs. Here's how it works. On a regular basis, our physicians visit your community to see residents in person. These visits cover routine check-ins, chronic disease management, medication oversight, and follow-up care. When an urgent issue comes up in between those visits, your staff and your families don't have to wait days or weeks. We connect through our telehealth platform 24/7. If the situation requires an in-person evaluation, we arrange a prompt follow-up visit to the facility or the resident's home. The difference is that your community has a direct line to a medical team who already knows your residents. In addition to regular care, we also bring medical procedures to you. Many of the procedures that send residents to the ER today, like paracentesis for abdominal fluid, thoracentesis for lung fluid, or central line placement, can be safely done on site when scheduled. That means fewer hospital trips, less disruption for the resident, and less strain on your staff. A central part of our model is the role of the Sigma Humans liaison. This is a dedicated professional assigned to your community who serves as the bridge between your nursing staff, our physicians, and each resident's family. The liaison makes sure physician orders are implemented, updates are delivered clearly and promptly, and transitions, whether from rehab back to your care or from one level of support to another, are managed without confusion or delay. It's the role that ties everything together so no one is left waiting and no one feels left out. The impact of this model is easy to see. Residents experience earlier interventions and fewer unnecessary ER transfers. Families finally feel like there is one clear point of contact who knows their loved one's care plan. And your staff gains back time and peace of mind. They can focus on care instead of spending their energy chasing after providers and coordinating across a fractured system. This is not about replacing what you do so well. It's about supporting it. We do not bring you more administrative work, we do not change your systems, and we do not introduce more complexity. There are no contracts or hidden costs. Our services are billed directly to resident insurance. We fit into your community with one goal: to make your model of care more connected and more responsive. If you'd like to see what this partnership could look like, let's start with something simple. Choose one or two residents, maybe someone with a history of frequent hospitalizations or someone with a complex care plan, and allow us to work alongside your team. You'll see how quickly this approach changes outcomes when your nurses have a physician on call, procedures can be scheduled in-house, and families know that coordination is handled. You can learn more at sigmahumans.com/bettercarestartshere or by reaching out to Amber Holmes, our liaison, at amber@sigmahumans.com. Thank you for everything you already do for your residents and your staff. We would be honored to join you in making care safer, simpler, and more connected, so that every resident, every family, and every staff member experiences the difference that timely, coordinated medical support can make.